As we age beyond 65, our bodies begin to whisper warnings before they ever shout. And one of the most silent yet dangerous changes that can occur is the gradual decline in heart health. What's truly alarming is that many seniors completely overlook the early signs of trouble, chalking them up to normal aging, fatigue, or other unrelated issues. But the truth is, your heart is one of the most vital organs in your body, tirelessly working day and night to pump life-sustaining blood throughout every cell. And when something starts to go wrong, when the heart begins to strain, when arteries begin to narrow, when pressure builds or electrical rhythms become irregular, your body will send you signals. The problem is, most people don't recognize them as cardiac-related until it's far too late. One of the earliest signs that your heart may be in trouble is something you might brush off as insignificant: a feeling of persistent fatigue. We're not talking about the kind of tiredness you feel after a busy day or poor sleep. This is a deep, ongoing, bone-level exhaustion that seems to persist no matter how much rest you get. Many seniors experience this and think, "I'm just getting older," but in reality, it may be a sign that your heart is no longer pumping blood efficiently. If your body isn't receiving enough oxygen-rich blood, you'll feel drained, especially during mild exertion, like walking upstairs, grocery shopping, or gardening. It's your body's quiet way of telling you the pump isn't keeping up with demand. Another critical early symptom that many over 65 ignore is shortness of breath during activities that previously posed no issue. When your heart begins to weaken or stiffen, fluid can accumulate in your lungs, making it harder to breathe deeply. You might notice you can't take a full breath when lying down flat, or you may find yourself waking up at night, gasping, or needing to prop yourself up with pillows. This shortness of breath can start subtly and worsen over time. And because it overlaps with conditions like asthma or COPD, many seniors and even their doctors miss the cardiac connection. Still, it's one of the clearest indicators that your heart isn't functioning properly and is under strain. In fact, shortness of breath paired with swelling in the ankles, legs, or abdomen is a red flag that the heart is not moving blood through the body effectively, and that fluid is backing up, a hallmark of congestive heart failure. Swelling, or edema, may look like nothing more than a puffier foot or slightly tight shoes at first. But when you press on your skin and the indentation lingers, it's a strong clue that your circulatory system is overwhelmed. This doesn't mean panic, but it does mean immediate attention is needed. Ignoring these symptoms increases the risk of hospitalization, complications, or even sudden cardiac events. Another sign that's both common and underappreciated is chest discomfort. Not necessarily the dramatic, crushing chest pain we see in movies, but rather a feeling of pressure, tightness, squeezing, or heaviness that may come and go. Some seniors report discomfort in the neck, jaw, shoulders, or upper back rather than the chest itself. And in women especially, symptoms can present much more subtly. That's why many older women don't realize they're experiencing early signs of heart trouble until they are in the emergency room. You may feel what you think is indigestion, lightheadedness, or an unexplained anxiety-like sensation in the chest that's difficult to describe. These are not just odd occurrences. They may be warning signs of angina or restricted blood flow to the heart muscle. When the heart isn't receiving enough oxygen, even temporarily, it signals distress in these subtle ways, and catching them early can literally be the difference between life and death. It's important to note that not all cardiac symptoms appear during exertion. Some might manifest during rest or even when you're relaxed. Pay attention to any recurring discomfort that doesn't have a clear explanation. Keeping a daily log can help your doctor see patterns that you might overlook. One more critical sign that's often dismissed is heart palpitations or an irregular heartbeat. Many seniors occasionally feel their heart flutter, skip a beat, or pound unusually hard, especially at night. While these sensations can be caused by stress or caffeine, persistent or recurrent episodes should not be ignored. An irregular heartbeat, known as arrhythmia, could signal atrial fibrillation, a common and dangerous condition in older adults that significantly raises the risk of stroke. What's tricky is that some seniors experience no symptoms at all, while others may feel dizzy, faint, or experience mild chest pain during these episodes. That's why regular checkups and reporting any noticeable changes in heart rhythm are absolutely essential. Atrial fibrillation can be managed, but only if caught early. Left unchecked, it can cause blood clots, heart failure, and serious complications that could have been prevented with the right monitoring and care. Technology today even allows for wearable devices to track heart rhythm, and many seniors are now using smartwatches or portable ECG monitors at home as an early warning tool. This proactive approach is proving to be one of the most valuable habits seniors can adopt when protecting their hearts from silent progression toward trouble. Sometimes, the body sends warning signals that don't seem connected to the heart at all, which is why they are so often overlooked. One such signal is persistent nausea or a lack of appetite. You might assume your stomach is the problem, or that it's a reaction to medication, or even that it's just a normal change in your eating habits as you age. But in reality, these symptoms can indicate your digestive system isn't getting sufficient blood flow due to a weakening heart. When the heart struggles to circulate blood effectively, the body starts prioritizing vital organs like the brain and lungs, leaving the gastrointestinal tract with less oxygen and nutrients. This reduction can cause digestive distress, bloating, discomfort after meals, or even an overwhelming sense of fullness after eating very little. Seniors who suddenly find themselves eating less or avoiding meals because of vague stomach issues should take note, not just for nutritional concerns, but for potential cardiac implications. Unexplained weight loss or a steady decline in energy levels may also accompany these changes, and taken together, these may all point towards something deeper going wrong in the cardiovascular system. Another little-known but surprisingly common early sign of heart trouble is confusion or memory lapses. It's easy to chalk this up to normal cognitive aging or early dementia, but the connection to heart health is crucial. When your heart isn't pumping enough oxygenated blood to the brain, your mental sharpness can decline. You may find it harder to concentrate, follow conversations, remember names, or stay focused on simple tasks. This mental fog may come and go, especially during physical exertion or in the evening when the body is more fatigued. Often, seniors experiencing these symptoms won't recognize the cognitive changes themselves. It's more likely that a spouse or loved one notices. But when these symptoms are paired with other physical warning signs like breathlessness, swelling, or palpitations, they form a clearer picture of a heart under strain. Doctors are increasingly recognizing that cognitive decline in seniors isn't always rooted in the brain. It may begin in the heart. That's why holistic evaluation is so important, and why seniors and their families should take any mental changes seriously and report them promptly. Getting the heart properly evaluated can often improve brain function as blood flow is restored, and many seniors are amazed at how much sharper and more alive they feel once the underlying cardiovascular issue is addressed. One of the most unsettling early symptoms of heart disease in older adults is dizziness or fainting, especially when standing up quickly or turning suddenly. These moments might last only a few seconds, but they can be dangerous. When the heart can't maintain stable blood pressure or consistent blood flow to the brain, even minor changes in posture can cause sudden drops in circulation. This can result in lightheadedness, a sense of spinning, or even complete blackouts. For seniors, these episodes pose a serious fall risk, which in itself can lead to a cascade of complications, including fractures, surgeries, and long recoveries. Many seniors assume dizziness is due to inner ear problems, low blood sugar, or dehydration, but when it happens frequently or without a clear explanation, it could indicate the heart isn't maintaining adequate blood pressure. In fact, some medications used to treat high blood pressure or other chronic conditions may compound the issue. So it's crucial to assess whether faintness is a sign of overtreatment or of underlying cardiac dysfunction. The subtlety and variety of these symptoms are what make early heart disease so dangerous. Many of them can be explained away individually, but when considered together, they paint a clear warning of a deeper, potentially life-threatening issue. Perhaps one of the most overlooked and yet visually noticeable signs of heart trouble is the condition of your skin, specifically the appearance of your extremities. Seniors with early-stage heart disease may notice their fingers and toes becoming cold, even in warm environments. This is a sign that circulation is impaired and the blood is not reaching the outer parts of the body efficiently. In more serious cases, you may see a bluish tint to your lips, fingertips, or toes, which is a signal that oxygen levels in the blood are dangerously low. Additionally, seniors may experience numbness or tingling sensations in their limbs, which are often misattributed to neuropathy or arthritis. While those conditions are certainly valid possibilities, the underlying circulatory function should not be ruled out, especially if these symptoms are new or getting worse. Watch also for changes in skin texture or slow healing wounds on your feet or legs. These are signs that blood flow is compromised. Seniors with diabetes are at especially high risk, as reduced circulation paired with nerve damage can delay healing and mass pain. Keeping an eye on your skin, nails, and the temperature of your extremities offers important visual clues into your cardiovascular health and may help catch problems long before they escalate. Another overlooked but highly telling early warning sign of developing heart issues in seniors is persistent fatigue, not the kind that goes away after a nap or a good night's rest, but a deep, unshakable sense of exhaustion that lingers through the day and makes even simple tasks feel overwhelming. You may find it difficult to walk up a flight of stairs, carry groceries, or even get out of bed in the morning without feeling drained, even if you've had a full night of sleep. This kind of fatigue is your body's cry for help, a signal that the heart is struggling to pump enough blood to meet your body's needs. As circulation weakens, muscles and organs receive less oxygen and nutrients, which lead to slower recovery and quicker exhaustion. It may start subtly. You may just feel like you're slowing down with age, but when paired with other signals like shortness of breath or palpitations, it's a powerful indication that the heart is no longer operating efficiently. Many seniors blame this on aging, arthritis, or side effects of medication. And while those can all contribute, if you're feeling more tired than usual without explanation, especially during activities you used to do easily, it's time to ask your doctor to take a closer look at your heart health. Swelling in the lower limbs, specifically the ankles, feet, and calves, is another powerful sign of trouble that is too often dismissed. This swelling, known medically as edema, occurs when the heart isn't pumping blood effectively, causing fluid to build up in the tissues of the lower body due to gravity. You may notice your shoes feel tighter, socks leave deep impressions, or your ankles look puffy at the end of the day. For seniors who spend a lot of time sitting, especially in recliners or soft couches, this could be particularly pronounced. It's common to dismiss this swelling as harmless, or to think it's related to hot weather, too much salt, or a lack of movement. But in many cases, it's an early indication that your heart is starting to fail in its job of returning blood from the lower body back to the chest. Left unchecked, this fluid retention can worsen, moving into the abdomen, lungs, or even causing sudden weight gain as the body holds onto water. A heart that's under strain often shows signs in this very quiet, visible way, and being attentive to these clues can make a critical difference in catching heart failure early, before more severe complications like shortness of breath, chest pain, or hospitalization arise. Equally alarming is the growing issue of disturbed sleep linked to undiagnosed heart problems in older adults. While sleep changes are expected with age, One particular pattern that deserves attention is frequent nighttime waking due to breathlessness or the need to sit upright to catch your breath. Seniors may notice they can no longer lie flat comfortably and begin propping themselves up with multiple pillows. This phenomenon, known as orthopnea, occurs when the lungs begin to fill with fluid while lying down, a classic sign of congestive heart failure. Many seniors initially think it's just acid reflux, anxiety, or simply old age making them restless. But when your sleep is interrupted by the feeling of drowning or gasping for air, it's a red flag that demands immediate medical evaluation. Compounding this issue, the lack of deep, restful sleep further worsens heart health, as the body doesn't get the restorative recovery it needs, leading to a cycle of daytime fatigue, reduced activity, and worsening symptoms. Sleep apnea, especially central sleep apnea, is also more common in people with heart issues, causing periods of stopped breathing during sleep that strain the heart further. If you or your loved one wakes up multiple times a night or finds they must nap during the day to compensate for poor sleep, it may be time to rule out cardiovascular problems as a root cause before assuming it's something benign. Finally, one of the most subtle yet deeply dangerous signs of early heart problems is emotional instability or mood changes. Seniors with heart issues often report feeling unusually anxious, depressed, or irritable even when their life circumstances haven't changed. While these mood shifts are frequently attributed to aging, loneliness, or cognitive decline, science increasingly shows a powerful connection between heart and mind. When the heart struggles to deliver oxygen-rich blood to the brain, it affects regions that regulate mood, motivation, and behavior. Some seniors describe a growing sense of dread or anxiety that comes out of nowhere, or a creeping depression that doesn't respond to typical interventions. Others experience sudden bouts of panic, irritability, or even aggression that's out of character. What's more, some of these emotional disturbances can be early warning signs of cardiac events like heart attacks or arrhythmias. Sadly, many seniors are placed on psychiatric medications or told to attend counseling without ever receiving a proper cardiac evaluation, delaying the real diagnosis. The emotional component of heart disease is complex and often overlooked, but it's real, and recognizing it can lead to earlier diagnosis, better outcomes, and a fuller understanding of the whole body effects of cardiovascular decline. As we wrap up, remember that your heart is the engine that powers every moment of your life, and catching these subtle signs early can make all the difference between living fully and struggling with serious health issues down the road. No matter how small or easy to dismiss these symptoms may seem, they're your body's way of speaking to you, asking for attention, care, and action. Don't ignore unusual fatigue, swelling, disrupted sleep, or changes in mood, because these can all be signals that your heart needs help before a crisis strikes. The good news is that with the right awareness, timely medical checkups, and lifestyle adjustments, you can protect your heart and enjoy many more years of vibrant, meaningful living. Always keep communication open with your healthcare provider, seek support from loved ones, and make heart health a priority every day. Thank you so much for spending this time with us here on Healthful Living 60+. We're committed to bringing you the latest, most important information to help you live healthier, happier, and longer lives. If you found this video helpful, please hit the like button and share it with family and friends who might also benefit from these life-saving tips. Don't forget to subscribe and click the notification bell so you never miss an update on senior health and wellness. Your well-being is our mission, and together, we can build a community where aging is celebrated with knowledge, strength, and hope. Take care of your heart, listen to your body, and keep living life to the fullest. We'll see you in the next video with more vital advice and encouragement for your health journey. Stay strong, stay informed, and as always, thank you for being part of Healthful Living 60+.